Researchers at LSU Health Shreveport have recently been awarded over $7 million in grants for research into a wide range of topics, including cancer, neurological disorders, cardiovascular disease, and mental health. Dr. Jason Bodiford received $1.625 million to study human papillomavirus.
Yes, it was from the National Institute of Allergy and Infectious Disease. And the purpose of this grant is to focus on two different aspects of HPV biology. One is growth factor signaling, and the other is the immune response. And it turns out that these two areas are related to each other, and both of them have an impact on virus replication. We have a technique in the lab that's kind of cool that allows us to basically make an artificial skin in the lab. We make an artificial dermis that has dermal cells in it, and then we make an artificial epidermis on top of that that has the virus in it. And so we can examine what happens in the dermis, what happens in the epidermis, and then the way the two layers interact with each other. Well, we have a good vaccine for HPV that prevents infection. The problem is that millions and millions of people are already affected, and so the vaccine won't help them. So we want to understand, how does the virus persist? What makes it so that it can stay there for months and years to ultimately develop into cancer? And so we're hoping that if we understand how the virus and the cell interact with each other better, we might be able to interrupt it and prevent the virus from persisting and clear infections that are already there.
Dr. Guo Hong Li received nearly $1.6 million to further his investigation into ischemic stroke. Currently, there is only one drug, TPA, approved by the FDA for stroke treatment, and it is only effective up to 3 hours after a stroke occurs.
We explore the new approach to extend the TPA therapeutic time window up to 6 hours after ischemic stroke.
Dr. Li has received nearly $5 million for research into stroke and vascular injuries since 2013. Dr. Raana Scott received $1.8 million from the National Institute of Dental and Craniofacial Research.
This is a collaborative project with Dr. Lindsay Hub-Fletcher, Dr. Sherry Ann Nathan, Dr. Jason Bodiford, and Dr. Martin Sapp. We are studying Epstein-Barr virus, and this is a tumor virus that is associated with a number of different malignancies in B cells and epithelial cells. And we're trying to understand how EBV can cause oral cancer. So we find that the virus is present in some oral lesions, cancer lesions. This is a co-association with a second tumor virus, human papillomavirus, and we're trying to understand if these two viruses might synergize in the cause or development of these types of oral tumors. Well, what we hope to do is to develop some new biomarkers that we can find these cancers at an earlier stage. These patients present with very severe disease, and in the past it used to require surgeries that would leave these patients with a lot of morbidities, difficulty swallowing, speaking, and so forth. So if we can catch them earlier, we may be able to prevent that type of morbidity.